Hello and welcome to Everyday Oral Surgery. This is your host, Dr. Grant Stucki. I am an oral and maxillofacial surgeon practicing in Denver, Colorado. The goal of this podcast is to connect, learn, and inspire. In this podcast, you'll be hearing from OMS surgeons all over the globe discussing ways to improve the practice of oral and maxillofacial surgery. Most information shared in this podcast will be based on personal experience and opinions, so please supplement what you learn here with approved research studies. Without further ado, please enjoy today's episode. All right, welcome back to another episode. Today I'm with Dr. Mina Fahmy. He is an oral and maxillofacial surgeon practicing in Washington State. Mina, thank you for joining us on the podcast today.
Thank you, Grant. Thanks so much for having me. I'm excited to be on the podcast with you this morning, and it's truly an honor.
Yes, for sure. Appreciate you reaching out. I always love it when our listeners, people reach out and offer to be on the podcast, offer to have someone else be on it, have topic suggestions. That's really what guides everything we discuss on the podcast. So that's kind of the lifeblood of the podcast, or all those emails and texts that people send. So I appreciate you.
Absolutely.
Well, yeah, we could start maybe if you could give us a brief kind of background on your training and your current practice situation, that would be helpful.
Yeah, no, absolutely. So I completed dental school at Marquette University, and then I followed that by doing oral and maxillofacial surgery residency at the University of Tennessee Medical Center. While I was there, I actually obtained my master's degree in medical nutrition. And that dual background, the surgery and nutrition, kind of shaped how I approach patient care. I realized early on that what we do surgically is only half of the equation. How the body responds, heals, and remodels tissue depends on its metabolic and nutritional state. So I thought that was super important to do.
Awesome. And then today we wanted to kind of focus the podcast on nutrition, diet, things that can affect surgery and go into that maybe we don't often think about too much. Where would you start us on a topic like this?
Yeah, it's interesting. During residency, I noticed that, you could have two patients with the same surgery, and they could have completely different outcomes. And when you look a little bit deeper, it wasn't just about the comorbidities that the patient had or even the surgical difficulty. It often came down to their nutritional status. So that realization made me want to continue further and study biochemistry of healing a little bit more closely. But I think, we can start talking about, what's important to look at preoperatively from a nutritional standpoint, and based on that, how we can optimize patients for surgery and healing afterwards.
Okay. Yeah, that sounds great. Where do you start with your patients when it comes to pre-op nutrition?
Yeah, so that's a great question. A lot of it comes down to the questions that I ask my patients and the history and physical, and then lab work. So, there's a paper that we published back in 2021, actually with Ben Heckler from the University of Tennessee Medical Center, and it was published in JOMS, and we looked at how albumin levels, serum albumin levels, affect patients' healing after surgery, specifically patients who have oral squamous cell carcinoma. And we found that even mild reductions in serum albumin levels, at 3.5 to 3.9, were linked to more than 3 times the odds of wound dehiscence after oral cancer surgery, compared to patients who had a 4 or higher. So that study's kind of solidified what I've already seen clinically, that even normal-looking patients can be metabolically unprepared for surgery, even if their nutrition isn't optimized. So, looking at labs from that standpoint, that's a cheap lab to get, and looking at labs preoperatively can tell you kind of where patients are and where they need to be.
Yeah, so you mentioned albumin. What other lab things are you looking for pre-op that could guide this discussion and prepping them?
Yeah, so albumin is a really important one from a nutritional status, just simply from a protein standpoint, and we can talk about that a little bit later on. But vitamin D levels are really important to look at as well. I always ask patients about, whether or not they were diagnosed with osteoporosis or osteopenia, and then we kind of go down that road. But there are so many different things that, like A1C levels, are really important to look at too, especially for individuals who tell you they're diabetic. And often, if they're well controlled, they will know what their A1C levels are. And you can kind of go down that pathway of whether they're immune compromised or how they will recover afterwards.
Okay. For those who maybe don't have a great A1C, maybe it's not horrible, but it's, needs some help. How would you guide them? I mean, do you just refer them back to endocrinology? Do you make suggestions?
So I make suggestions from a like glycemic index standpoint, from a dietary standpoint, but I certainly get people involved. I think it's really important to have a team involved, and sending them back to their PCP or endocrinologist is important because they are the ones that kind of carry the patients through their diabetic journey, if you will, and they will, monitor their medications and whether or not they have to adjust their medications. So that may help them.
Okay, got it. And then maybe just touching back on that, mentioning those with albumin levels that aren't optimized. What kind of dietary changes could help with that?
Protein. So, having a protein dense, nutritionally dense diet definitely helps, and that can certainly raise the albumin levels preoperatively from a nutritional status, and that will help patients recover afterwards.
Okay. I mean, and do you have suggestions about? I mean, does the type of protein matter? Is it protein powder? Is it eggs? Is it what? Does it anything make a difference there?
Yeah, I think protein, it depends. So different patients have different lifestyles, and I think that some people are plant-based and some people aren't, and with you can recommend whey protein, but that may not really agree from a digestion standpoint with some people. So I think just whatever works from a holistic standpoint. I
Okay.
think just increasing the level of protein in general. Whole foods are really important to take in. But if you can do the whey protein, if you can do plant-based proteins, just increasing the amount of protein is really important. I would say 1.2 to 1.5 grams per pound of weight is really important.
Nice. Okay. And then for elderly patients, I mean, those probably going to see that osteoporosis, osteopenia more in those subset of patients. But how do you help them if there is, bone issues, immune problems in the elderly?
Yeah, so it's often a question of, how do we support those people? And I think like I said, I always ask patients, especially elderly patients, whether or not they've been diagnosed with osteoporosis or osteopenia, because that may delay tissue regeneration. I think there's also the standpoint of age-related bone density loss and how that affects implant stability and healing. So from a nutritional standpoint, I usually tell patients, to take in calcium and vitamin D. But with that, the vitamin K2 for the calcium deposition in bones, and then supplement with collagen, peptides, and magnesium just to support the bone matrix and soft tissue integrity.
Okay. And then, I mean, just from a logistical standpoint, who of these patients, like pre-op, are you getting labs on? How are you doing this? Because it's probably not a very common thing for the private practice-based surgeon.
Yeah, good question. And I lean on the primary care. It's really important to have a strong team of practitioners. We shouldn't really take everything on, and I think that it's probably not good practice to do that. I think that everyone is specialized in their own area of expertise, and getting the primary care involved, getting the endocrinologist involved, getting the rheumatologist involved, getting the dietitian or nutritionist involved is really important, just to have a strong team, and you get different perspectives and a lot of brain power there. So from a lab standpoint, if I feel like there are certain labs that I need or certain labs that would be important, such as an A1C or something like that, I would refer to their primary care or their endocrinologist. And usually what I'll do is I'll write them a letter or give them a call, kind of discuss the situation and what we're trying to do or the procedure that we're planning for, and then go from there. I think communication is important.
Okay. Nice. And then anything else pre-op that you do for patients? I mean, there's certain supplements you're like recommending most take, or what other things you do.
Yeah, so I mean, there are supplements that we can talk about. There's a lot of talk about supplements, and I get that question a lot. Almost every every talk I give or every lecture I give, people always ask, what do you recommend for supplements? And it's on a case by case basis, but I can tell you, there are certain supplements that I personally take that I believe in, and there are certain supplements that can help you from like a immune standpoint, and from an inflammation standpoint. Things like CoQ10, right? Coenzyme Q10. It's a really powerful antioxidant in the mitochondria. It supports ATP production. It can improve gingival health, reduce post-op inflammation. Things like collagen, those things will provide essential amino acids, the glycine, proline, that serve as a structural framework for new tissue formation. Even things like zinc, right? Crucial for DNA synthesis. And a deficiency in zinc can actually significantly delay wound healing. Omega-3 fatty acids. I can go on and on. These are big ones. Omega-3 fatty acids will reduce inflammation, enhance blood flow, reduce swelling, support bone remodeling, and then vitamin D and K2 we talked about briefly, but those are really important as well, to enhance calcium absorption and modulate the immune response. So, those I usually tell people, and again, it's really personalized to the patient. Even from the standpoint of, preoperatively as oral surgeons, we always take, vitals, and if a patient's blood pressure is slightly elevated, I'll recommend certain things like beetroot powder, for example, that could certainly help. Or if we talk about inflammation, we'll talk about the things we just talked about, but also like turmeric powder. Things like that can certainly help and make a difference in patients day to day.
Yeah, that's helpful to run through those. Definitely seems like the recurrent, if I had to go down to two, like the recurrent things I hear in health books is probably vitamin D and like fish oil. But yeah, I'm hearing a lot about coenzyme 10 and all the various B complexes and things like that. So sometimes it's hard, I think, for people to know and not get lost in the weeds and have like, 20 pills are taken a
Yeah,
day.
yeah.
Anyhow, okay. Well, how about we switch gears and talk about post-op? What type of things do you recommend post-op?
So it depends. So, we can talk about the different patient populations. So, there's the implant patient, there's the wisdom tooth patient, there's the facial trauma patient. There's different types of patients that we will see on a day-to-day basis. But for example, if we take implants and bone graft patients, usually the first 48 hours, I tell them to stick to a cool, liquid kind of food like smoothies, no seeds. Broths are really good, yogurt, protein shakes, things that will help reduce bleeding, swelling, and strain. Avoid hot, spicy, or carbonated drinks. And then as we progress to things like day 3 to 7, we transition to a more soft, non-irritating food like mashed potatoes, scrambled eggs, pureed soups. Again, avoiding the crunchy, sticky, chewy foods. But like I said previously, I think this can't be overstated. The protein is really important. So 1.2 to 1.5 grams per kilo per day is important. You can get that from a variety of sources. Eggs, Greek yogurt, tofu, things like that. But I'm sure we're going to touch on this a little bit later on. But one thing in addition to that is to stay well hydrated, and then, rinse gently with salt water just to promote healing and hygiene.
Yeah, I love that too. I mean, I'm in Denver, a mile, above sea level, super dry.
Yeah.
Lot of people suffering from dehydration and also just, of course, with the cold, vitamin D levels being low. So those are things we're frequently kind of reiterating to our patients.
What do you personally tell your patients about hydration, Grant? Do you, give them any specifics on what to do?
I don't unless they bring it up, although I think I should be more proactive, with just blanket statements. And I think just talking to you, this makes me think more about the conversation I have with my patients right before we're about, to sedate someone and begin a surgery. Usually we have the discussion and say, okay, well, for a couple days, it's cold, soft foods and here's some examples of foods. But like that in that moment, I think is ideal time to discuss hydration, supplements, anything they can be doing to help. But I mean, what specific guidelines do you give about hydration?
Yeah. I think it's like, so the guideline, and this isn't like a strict guideline, but it's like half your body weight in pounds. And that's how many ounces you should be drinking in a day. So say you're 160 pounds. So if you divide that by two, that's 80. So that's 80 ounces, which is probably that's about 2.4 liters, right? So
Mhm.
that's kind of the soft guideline that I tell patients. But it's not just water, right? You want the electrolytes as well. So mixing in, you kind of want the magnesium, potassium, sodium type of deal. So, but even mixing in like Celtic salt or something with water just to stay hydrated is important. I see a lot of pathology patients, so people that have had head and neck radiation, a lot of times, they're xerostomach, right? So I always tell them to carry a bottle of water wherever they go, all the time, all day, just have a bottle of water with you, and
Yeah.
continuously take sips of water in. And that's a good way to stay hydrated and remind you to keep taking in water.
Yes. I think a lot of our patients are getting better at having what do you call those? Like the 40-ounce big
Yeah, the
cups,
tumblers, those big ones.
tumbler. Yes, yeah,
But that's like a fad, right? Like it was a big fad for a while. Everybody was getting those big containers, but it's good. I mean, it's good. It's a good way to stay hydrated for sure.
yeah. I don't know if you get into the specifics of what kind of water. One health guru I follow is all about water. It's like coming from spring water that's like in glass bottles. I mean, it can get pretty intense.
Yeah, you can get in the weeds for sure. I mean, glass bottles, yes. I am a proponent of glass instead of plastic. But I don't really get into where it comes from or what kind of water it is or anything like that. But just staying hydrated in general, because truthfully, that can get expensive too. And
Yeah,
a lot of people,
for
it,
sure.
it just it's whatever you can get, in my opinion. Just stay hydrated.
Yeah. What are your thoughts on incorporating nutrition counseling into the workflow of our practice and or referring people to nutritionists? I mean, how do you incorporate things like that?
Yeah, I think especially if you haven't done it before, start out easy and just use brief, structured checklists during consults. Screen for red flags, and when I say red flags, I'm talking, weight loss, any deficiencies. Perhaps provide a one-page nutrition handout. Delegate follow-up discussions to trained assistants, or even integrate a short nutrition module into post-op calls. Um, my guides are concise, they're visual, and phase based. So I talk about how you start with like a liquid diet and progress to a soft diet and a regular diet, kind of like how we trained, right? Like how we did it in the hospital, depending on if we had an orthognathic patient or a pathology patient or a trauma patient. You start them off with a liquid diet and then soft non-chew diet, and then they progress to regular diet. And each one of those phases can include food lists and supplement recommendations and hydration tips. And you can just build your own, customize it, to each patient, whether it's an implant patient or a graft patient or an orthognathic patient. And I would just keep them simple and evidence-based. I think, to touch on your question about collaborating, I think, partner with a registered dietitian in your area, especially for high risk or complex patients. And I think what works best is just a referral system with clear communication, like we talked about, where the surgeon outlines surgical goals and the dietitian can manage the nutritional optimization and follow up. But I think just doing those things can certainly help our patients.
Yeah. It sounds like you're very deliberate and specific in regards to nutrition and providing patients with information, which is just so fantastic. I think probably most of us don't do much with that and kind of skip over that step, but I mean, we know that it's just so critical. Our diet, hydration, all the things, that are feeding our microbiome, linked to our healing and all the rest of the body. Have you noticed anything as in regards to patient satisfaction and surgical outcomes when it comes to
Yeah. Yeah, definitely. I think patients heal faster. They experience less swelling and infection. They feel more supported in recovery. I think that, talking to them and from just not just a surgical standpoint, but from a holistic standpoint, they feel more supported. They recognize that you care, about not just the surgery. And truthfully, they should go hand in hand. I think integrating nutrition builds trust, and it just enhances the perceived quality of care, and improves both clinical results and patient loyalty.
Yeah, I could definitely see that. Definitely the patients that I spend some time with and start talking with about diet always seem to appreciate it more. Probably because it's something that even in medicine, it's really not a focus. I think you could go
Totally.
well, medical school and dental
Oh,
school,
totally, totally, yeah.
maybe get one or two lectures on diet and nutrition.
If that, yeah, I totally agree. I remember, so I talked to my, our medical colleagues, and in medicine and dentistry, I feel like you don't really get much at all. I think we only got one lecture on nutrition, and in residency, it kind of clicked where it was like I don't really know anything about nutrition, and people in the hospital don't really know unless they're a nutritionist or a dietitian. So that's what prompted me to actually do my medical nutrition master's, because I just felt like I was lacking in that area. So I totally agree. I think that should change. The curriculum should involve a significant um, transfer of information when it comes to nutrition and how we should optimize patients.
Yeah, I agree as well. If there's a surgeon who's listening to this that wants to kind of take these steps to inform their patients more and have that aspect of nutrition, diet, hydration, all this stuff incorporated more into their patient experience, where would you recommend they start?
Yeah, I would say start small. Develop a one-page, healing nutrition after oral surgery type page, and or a guide, and begin mentioning nutrition briefly at every consult. I think consistency, not complexity, is what creates lasting impact. So, I think that starting small and continuing to do it day in and day out will help you to get into that rhythm.
Awesome. How about, I guess, this field or this aspect of nutrition and oral surgery and um, probably dentistry as well? Where do you see this heading for us?
Yeah, I think we're going to see nutrition move from being an afterthought to becoming part of the standard surgical protocol. So I think in the next few years, we'll likely see oral surgeons incorporating pre-op lab panels, genetic markers, targeted supplementation into their treatment planning. And it won't just be about what to eat after surgery. It'll be about optimizing the body's healing environment before the first incision is made. So I think it'll get better. I think the more education is put out there, and that's my goal, is to kind of spread the knowledge. Is once people realize how important nutrition is, I think it'll become more and more incorporated.
Yes. That it just sounds so awesome because there's so much becoming available to us and there's more research being done.
Absolutely.
Yeah, being able to incorporate this and help your patients from that standpoint would be so powerful. How about any last minute thoughts or like a takeaway you'd hope our listeners get from this discussion?
Yeah, if there's any one takeaway, I would say it's that nutrition isn't separate from surgery, it's part of the surgery. So the success of a bone graft or an implant isn't just technique, it's biology. So thinking of nutrition as a clinical tool, not just a lifestyle suggestion, completely changes outcomes.
Yes, 100%. Um, are you on social media or do you have a presence there or things that you're kind of trying to?
Yeah. So I run an Instagram page. It's called Save That Face, and we talk about all things oral surgery. It's an education based platform, and we have interviews on there, and a lot of just little tips and tricks here and there from a surgery standpoint. So people can definitely reach out to me there, and I'm happy to communicate and interact.
Nice. Well, if you're good with it, I can put some contact info in the show notes if listeners have further questions.
Absolutely.
I would love to see some of the documents you use, and get maybe could be a springboard for my own practice. It'd be cool stuff.
Awesome.
We end every podcast with some rapid fire questions. So First one is, what's the best book you've read in the past year?
Oh man, I think Outlive by Peter Attia, great book. I've
Oh
read it
yeah.
twice, and I think it's really good. It just talks about centenarians and how to just become better at life. So I think it's. Have you read that one?
I have, yeah, also a couple times. Love it.
Yeah, it's a good book. It's a lot of information, but I feel like it's backed up, it's evidence based, and it's a great book.
Yeah, I mean, based on that and other nutritional stuff, what's one power tip that you personally live by every day from a nutrition standpoint?
Consistency. I think it's all about consistency and simplicity. Just focus on real, anti-inflammatory foods. Stay hydrated. Never skip your protein. I look at food the same way I look at surgery. Precision matters, and every bite that you take is either fueling, healing, or fighting against it. So I think that just stay consistent, stay simple.
Awesome. How about most helpful kind of outside of work thing that you do that potentially translates to oral surgery skills in the office?
I think I don't know if this answers your question directly, but I think just staying balanced in life. It's not all about surgery, and it's you got to also have your family time and social time, and just being mentally present. In time. I think it actually helps you become better as a surgeon and better in the clinic. So I think just balance in general is really important.
Awesome. What forceps do you use to extract tooth number 20?
I use the 151.
So,
What do you use? Do you use the ash?
usually, probably
Yeah.
the ash is a good for twisting.
Yeah.
But I will say, if it's like you have to have a big opening in your mouth because the ash is the taller, inch.
Yeah. To be honest, I don't use the ash very often at all. Even for anterior teeth, I'll use the 150 or 151.
Yeah. What I do like about the 150s is they're a little thinner. The ash can be bulkier.
Yeah, the curve, right?
Yeah. And
Yeah,
so
I agree. Yeah, you can use the 150 even for lower teeth, right?
yeah, because you can't, yeah, especially if you're dealing with those small anterior teeth, like an ash could potentially damage adjacent teeth. You want to be really careful where you're using it for sure.
The peto ones are good too. Like you could use the peto 150 or 151 because those can get into small spaces.
Yes, for sure. How about best movie or TV series you've watched in the past year?
Oh man. So I I repeat series a lot. I watched Suits. Have you watched that show? So Suits, I
Yes.
twice. I just finished watching it again. I love that show. It's a great show.
Who's your favorite character in Suits?
Oh man, probably Harvey Specter, right? I mean, or Donna Paulson. No, they're
Yes.
they're all great characters. Even actually, Lewis Litt might be a really good one.
That's what I was going to say.
Yeah. Lewis was always a favorite on that show. He's a great actor. But yeah, that's a great show. I think in a previous life, I probably could have been an attorney.
Oh, yeah. Love it. Harvey Specter is one of those guys you just, you kind of, everyone admires. You want to be like that. It just always has the right.
He's the man, He's the
Yeah,
closer.
exactly. Do you ever go mudding like Lewis Litt?
I've never been mudding. I've never.
Just checking.
I don't know if that's actually a thing, but yeah, Lewis Litt definitely likes the mudding.
Okay. Last question. What is your favorite quote?
Favorite quote? I don't know. I can't think of one off the top of my head. There's so many, and I'm not great with quotes because I can't. I can usually not remember them like word for word, but I kind of remember the gist of it. But yeah, I can't think of one right off the bat.
No problem. Yeah, those can be tougher. There's always those in residency. I feel like sometimes most
Well,
of us.
those are just usually ones that your attendings say, and you
Yeah,
just you just remember them.
yeah. Most of our attendings, their quotes were just work harder. Do do more. And as a resident, it's like, oh man, I'm already running ragged.
Yeah, that's right. It's we used to. So we worked at a big level one trauma center, and we'd have a ton of trauma, and a lot of it would come in pretty late. And I remember operating with our chairman, who was a fantastic surgeon and an awesome mentor. And he would always say, nothing good happens after midnight. We'd always get, bad trauma late at night. But yeah, it was fun. It was fun operating with the guys.
Yeah, so it was fun. Well, Mina, thank you for taking the time today. This is a very important topic, and I appreciate you being willing to share some of this content and also being willing to be open for those who want to reach out and talk to you directly.
Awesome. I appreciate you, Grant. This was a blessing. It was an honor. It was great to be on the show with you.
Excellent. Well, let's reconnect sometime and do another episode.
Absolutely. Always.
All right. Have a good day. Thank you.
You too, man.
Thank you so much for listening to this episode of Everyday Oral Surgery. For more information on these podcasts, please visit everydayOralSurgery.com. I love feedback and would be very grateful if you would reach out to me via my email, grantstucki@gmail.com, and let me know what you thought of this episode. Or you can text me at 720-441-6059. Additionally, if you have any topics you'd like to hear about, or if you would like to be a guest on the podcast, please email or text me. I found many of my interviewees through people who have been contacting me and I've been listening, and I've gotten so many great ideas for more podcasts, and that's what helps keep the podcast rolling. So I really appreciate you making that extra effort and helping me out with feedback and knowing what to do next on the podcast. Thank you so much.